Bismillah ar-Rahman ar-Rahim. My lecture today is about the facial spaces of head and neck. The facial space is a potential space between the layers of fascia. In health, these spaces do not exist. They are only created by pathology. Let's say the spread of pus or cellulitis in an infection. These spaces are normally filled with loose connective tissue and various anatomical structures like veins, arteries, glands, and lymph nodes. What we mean by potential space? Potential space means الفسحة الكامنة. يعني هذه الفسح بالأوضاع الاعتيادية الطبيعية تكون غير موجودة not exist مغلقة. لكن إمتى تكون تنفتح وتكون موجودة؟ تكون بحالة الحالة المرضية. يعني حالة مثال عندنا هنا spread of pus or in case of cellulitis، يعني وجود الصديد أو القيح or cellulitis التهاب الأنسجة الرخوة. حالة الالتهاب، فمن يكون عندنا التهاب الأنسجة الرخوة راح يتكون عندنا inflammatory fluid، وإذا تأخرت الحالة وما تعالج بشكل صحيح ممكن يتحول إلى abscess collection of pus. متكون عندنا البص، وين راح يكون هذا البص؟ راح يكون هذه السبيس اللي كانت مغلقة في الحالات الاعتيادية، وبعد الالتهاب راح تنفتح وينجمع بها الباس أو الانفلاماتوري فلويد. بالأوضاع الاعتيادية بدون التهاب هذه الفسح البيتنت potential spaces تكون filled with loose connective tissue، تحتوي على loose connective tissue and various anatomical structures like veins, arteries, glands and lymph nodes. طيب فيشيا اللي تكوننا هذه البوتنشال سبيسز شنو تعريفها؟ The fascia it is defined as a broad sheet of dense connective tissue whose function is to separate structures that must pass over each other during movement, such as muscles and glands, and serve as a pathway for the course of vascular and neural structures. احنا بنتحرك عندنا العضلات على بعض، هنا عندنا muscles، ما بين عضلة وعضلة، ما بين muscle and another muscle beside it there is a layer of fascia of this sheath of connective tissue. وجود هذه الفاشيا ما بين العضلات يساعد العضلة أن تتحرك بحرية أكبر. يعني مثلا احنا عندنا عضلات الرقبة the muscles of the neck. When we turn our head to the right or to the left or up and down, all the muscles of the neck move at the same time. The movement of these muscles one over the other is facilitated تسهل by the presence of this fascia between the muscles. كذلك أيضا مثلا تسهل حركة الجلانس. how؟ مثلا أثناء عملية البلع نلاحظ أنه الحنجرة تصعد وتنزل. صعود الحنجرة ونزولها مع الغدة الموجودة فوق الحنجرة والحنجرة اللي هي ثايرويد جلاند الغدة الدرقية، لاحظ أن تصعد وتنزل. هاي الحركة لولا وجود الفاشيا لما كانت الحركة تكون سهلة. وبنفس الوقت هذه الفاشيا أيضا تكون تخدمنا as a pathway طريق أو مسلك for the course لمرور vascular and neural structures. كل الفاسكولار والنيورال structures تمر بالفاشيا، طبعا المين فاسكولار، بعدين طبعا متصل الأورجان اللي تغذيه تعوف الفاشيا وتدخل للأورجان اللي تغذيه سواء إذا كان vascular أو neural structures. To understand the facial spaces and where is these facial spaces, we should know the distribution of the fascia of this sheath of dense connective tissue, how it is distributed in the neck and in the face. So the fascia of the head and neck includes two main parts: the superficial fascia or superficial cervical fascia and the deep fascia. The superficial fascia is a single layer, but the deep fascia, it consists of four parts. The first part is called the superficial or anterior or investing layer. Investing يعني تحيط تغلف. And the middle or pretracheal layer, الطبقة اللي تكون أمام القصبة الهوائية. The posterior or prevertebral layer, اللاير أو الطبقة اللي تكون أمام الفيرتبري، تغلفنا الفيرتبري والمسلز اللي حواليها. وعندنا أيضا الكاروتيد sheath also is considered part of the deep fascia. Well, here this picture will show you these layers of the fascia. Here we have the skin. This is, of course, is a transverse section of the neck. This is face anteriorly, and this side face posteriorly, because this is the cervical vertebra, and this is the body of the cervical vertebra, and this is the cervical canal containing the spinal cord. This is spinal cord, and this is spine of the vertebra. And of course, anteriorly we have this opening is the trachea. This is the trachea. Behind the trachea, posterior to the trachea, we have the esophagus, or if the section is higher up, we have the pharynx, which is above the esophagus. And of course, this is the carotid sheath. So the first layer is the skin, the subcutaneous tissue, or it's called the superficial cervical fascia, containing this muscle. We will discuss it later on. And this is the superficial fascia. And the deep fascia, all these are the deep fascia, consists of 3 or 4 parts. This red line is the investing layer or the superficial layer of the deep cervical fascia. It continuous along or around the neck, just like a collar, مثل الطوق حول الرقبة. وتغلف لنا العضلات الموجودة بالرقبة، راح نذكرها بعد شوية. This red line is the investing first layer or anterior layer of the deep cervical fascia. The second part of the deep cervical fascia here, this is a green boundary, is the pretracheal fascia. Pretracheal fascia. And this fascia is the prevertebral fascia. This is the prevertebral fascia. And this blue colored line is the carotid sheath. Containing the internal jugular vein, the common carotid artery, and the vagus nerve. And of course here the superficial fascia containing the external jugular vein. This is the external jugular vein, and this is the external jugular vein within the superficial fascia. Okay. Now we discuss these layers in details. First of all, we have the superficial fascia. The superficial fascia is similar to subcutaneous tissue, just below the skin. The second layer below the skin is the subcutaneous tissue and the superficial fascia. It ensheaths تغلف لنا the platysma and muscles of facial expressions. So the platysma and muscles of facial expressions are enveloped by the superficial fascia. This superficial fascia extends from between which part and other parts. It extends from the zygomatic process to the thorax and axilla. So from the zygomatic process, it descends downwards to the thorax and axilla. Its contents are the platysma and muscles of facial expression, and of course also it contains the cutaneous nerves and vessels, and sometimes lymph nodes. The second layer of the fascia is the deep cervical fascia. The deep cervical fascia includes 4 parts. The first part is superficial, which is called also investing layer of deep cervical fascia. This fascia or this layer extends between the superior knuckle line of the skull, of the occipital bone, of course, the mastoid process, and separates anteriorly to the lower margin of the zygomatic arch, the lower border of the mandible, and attached inferiorly at the spine of scapula, clavicle, and mandibular sterni. تتصور شلون؟ يعني هذه الفيشة عبارة عن layer تمتد من بدايتها طبعا on both side، من جهة اليمين ومن جهة اليسار. احنا بنتكلم دائما التشريح نذكر بأنه ما يتكلم عن اليمين يتكلم أيضا هو ينطبق على اليسار. فهناخذ هسه مثلا extension from the right side. It extends from the posterior occipital protuberance of the occipital bone and the superior knuckle line، تمتد عليه هذا كله. و mastoid bone أيضا it attached to the mastoid bone and it spread anteriorly، تتقدم أو تنتشر للأمام to the lower margin، إلى lower margin of the zygomatic arch, and it descends to the lower border, also attached to the lower border of the mandible. All this is the superior boundary of the investing layer, and attached inferiorly and descend and attached inferiorly. Where it ends, this fascia, it ends inferiorly by attachment at the spine of the scapula. All of you remember the spine of scapula behind your shoulder. Also it attached to the clavicle and mandibular sterni. So this is on one side and other side the same. So it forms just like a collar covering or encircling the neck, and as we said, the boundaries of attachment superiorly and inferiorly. This layer envelops the sternocleidomastoid. When descent from above downward, it envelops many structures. It envelops the sternocleidomastoid and trapezius muscles and portion of the omohyoid muscle in the posterior triangle of the neck. In addition to that, these muscles, it also envelops the parotid gland and the submandibular glands. يعني هي من تمتد الفاشيا تصل لحد المصل. It's split into 2 layers to envelope، تغلفنا، to invest the sternocleidomastoid muscle. The sternocleidomastoid muscles completely invested or enveloped with this fascia. The same thing for trapezius muscles and part of the omohyoid muscle within the posterior triangle of the neck. In addition to these 3 muscles, the investing layer also envelopes تغلف لنا الparotid and the submandibular glands. The second layer of the deep cervical fascia, which is called the middle layer of deep cervical fascia, is the pretracheal fascia. Here, actually, it is not written here, but this is the pretracheal fascia, I say in front of the trachea. This middle layer of deep cervical fascia has two divisions, the muscular division and the visceral division. Why it is called muscular division and visceral division? Muscular division because it envelopes muscles, the infrahyoid muscles. So this muscular division attached superiorly to the hyoid bone and thyroid cartilage. Superiorly attached to the hyoid bone and thyroid cartilage. And inferiorly it attached to the sternum, clavicle, and spine of scapula. So, because this fascia or this division of the middle layer of the deep cervical fascia envelopes the muscles, the infrahyoid muscles, it is called muscular division. And it is limited between the hyoid bone and thyroid cartilage superiorly and sternum, clavicle, and scapula inferiorly. The second division is the visceral division, which surrounds the thyroid gland, trachea, and esophagus. Of course, these organs, thyroid gland, trachea, esophagus, are the viscera of the neck. So this fascia, the second part or second division, which is called visceral division, it surrounds the thyroid gland, trachea, and esophagus. This fascia superiorly attached to the base of the skull and then to the thyroid cartilage and hyoid bone. This is superiorly. Superiorly it attached to the base of the skull, thyroid cartilage, and hyoid bone. And inferiorly it descends to the central or to the middle mediastinum. Mediastinum هو المنصف أو it is the central part of the thoracic cavity. الجزء المركزي من التجويف الصدري والذي يحتوي على الهارت القلب والجريتر فيسلز. This visceral division after it encloses rim of the thyroid, trachea, esophagus, it descends to the thoracic cavity and it ends at the pericardium. Pericardium is the wall or the tissue that surrounds the heart, which is called شغاف القلب. It ends at this point in the middle mediastinum. The posterior layer of this cervical fascia, which is called the prevertebral fascia, it is also divided into two divisions. The first division is called the alar fascia. طبقة من الفاشيا يطلق عليها الألر fascia. This alar fascia passes through the transverse processes of the vertebrae. Keep it in your mind and remember the cervical vertebrae and its transverse processes. So this alar fascia extends from above downwards through the transverse processes of the vertebrae on either side, of course, on right and the left. And it is posterior to the retropharyngeal fascia. Retropharyngeal fascia, the pharynx, behind the pharynx and behind the esophagus, we have another fascia. Behind the pharynx, we have another fascia. Posterior to this fascia, which is behind the pharynx, is the alar fascia. I will show you in the next picture. This alar fascia, it fuses with retropharyngeal fascia, تندمج مع الريتروفارنجيال fascia اللي يصير أمامها at a variable levels between the 6th and 4th cervical vertebrae. يعني في مكانات محددة ما بين الفقرة العنقية الرابعة والسادسة the alar fascia fuses تتحد مع في مناطق محددة مع الريتروفارنجيال فيشيا، مع الفيشيا اللي تكون خلف البلعوم. Infection of the retropharyngeal space. طبعا behind the pharynx we have a space which is also potential space. But in case of infection and collection of pus and inflammatory fluid may appear and create it. If any infection occur in this space which is behind or posterior to the pharynx, if any infection occur here, this infection may damage, may rupture the alar fascia by infection, by pus, by infection, thus entering the inflammatory fluid and infection, thus entering the danger space. Where is this a danger place? The danger place which is continuous with the posterior mediastinum. The danger space is between the alar space and the last layer, which is the prevertebral fascia. So if the infection pass posterior to the alar fascia, it will become between in a space between the alar and the prevertebral fascia, and this space here, danger space, is continuous with the posterior mediastinum. احنا قلنا بين الميدياستاينم هو central part of the thoracic cavity, okay, containing the heart and blood vessels. This central part, this mediastinum, is divided into anterior mediastinum, middle mediastinum, and posterior mediastinum. The middle mediastinum ينتهي ب ذكرنا به أن ينتهي بال visceral fascia of the second layer، و السبيس الريتروفارنجيال سبيس إذا صعدنا infection هنا and the alar fascia opened, the infection will pass to the another space which is called danger space, which is continuous with the posterior mediastinum. طبعا of course if the infection reach this area of the mediastinum through this danger space, the situation is very serious، حالة تكون خطرة جدا، and it needs more urgent treatment علاج سريع، وإلا ممكن يعني الحالة المرضية تتفاقم وتصبح خطرة جدا. The last layer is the prevertebral fascia, and this prevertebral fascia surrounds the vertebrae and the attached postural muscles of the neck and back. طلف لنا الفقرات مع العضلات اللي تكون مع الفقرات. هنا this last layer of the cervical fascia is usually not invaded، عادة not invaded لا تغزى by infection، يعني infection ما يعبره. أي infection that arise in the maxillofacial region. Most of the infections or all the infections that occur، معظم الالتهابات اللي تصير عندنا بالماكسيلوفيشال ريجن مهما تقدم بها الانفكشن وتأخر ما راح يعبر البريفيرتبرال ريجن، البريفيرتبرال فيشيا ما يصل، ما يعبرها. Sorry. The last division or last part of the cervical fascia is the carotid sheath, and this fascia or sheath surrounds three important structures, which is the internal jugular vein, common carotid artery, and the vagus nerve. It is interposed تتوسط ما بين the investing and pretracheal layers on the one hand and the prevertebral layer on the other. Here is the carotid sheath, you see, on both sides. There's a carotid tube-like attached from the skull, base of skull, till the heart. And will be repeated. This is the pretracheal fascia. This is the investing layer, and this is the prevertebral layer. The carotid sheath here, actually this carotid sheath is formed from this fascia, from the investing and from the pretracheal fascia and from the prevertebral fascia. From this fascia, the carotid sheath formed and surrounds these important structures. بعد ما عرفنا توزيع الفاشيا in the neck، هذا التوزيع اللي شفناه ودرسناه للفاشيا in the neck هو اللي راح يعمل لنا أو يحدد لنا مكانات الفاشيال سبيسز in the neck. هو اللي يحدد لنا مكانات الفاشيال سبيسز. حقيقة الكلاسيفيكيشن of the facial spaces كثير ناس عملوا أكثر من كلاسيفيكيشن، تصنيف لهذه الفسحات اللفائفية facial spaces، and there are different classifications which is used to describe these facial spaces. The first classification is depend on the location of the space. So the first classification is depending on location of the space. Where is this space? This classification gives us 5 spaces. Space 1, which is the potential space superficial and deep to the platysma muscle. Space 2, the space behind the anterior layer of deep cervical fascia. I mean behind the investing layer of deep cervical fascia. Space 3 is the pretracheal space. Let's say it lies anterior to the trachea. Space 3A, it is the carotid sheath. Space 3A, it is the carotid sheath, zero vascular space, extending from the jugular foramen, this tube-like structure of fascia. It extends above from the jugular foramen and carotid canal at the base of the skull to the pericardium, or middle mediastinum, downward in the chest to the pericardium، غشاء اللي حوض القلب، اللي يحيط بالقلب، or to the middle mediastinum في الجزء الأوسط من منتصف الصدر من الميديستاينم. و space 4 which called the danger space is a potential space between the alar and prevertebral fascia. Between the alar and prevertebral fascia. It extends from the base of the skull to the posterior mediastinum. I will show you in this picture the presence of these. Of course, there's a transverse section on the neck showing this is the prevertebral fascia, the blue color, and this is the alar, which is the alar fascia. Between the alar fascia and طبعا of course this is the pharynx, and this is the pretracheal fascia. You see, behind the pharynx we have the retropharyngeal space، يعني الفسحة التي تكون خلف البلعوم، وطبعا العزة اللي جوا تكون خلف المرئ. This is retropharyngeal space. And here we have the prevertebral Fascia قلنا تنقسم two types, the alar fascia and the prevertebral fascia that encloses the vertebrae and the muscles of the back of the neck and some of the muscles here in front of the vertebrae. Between this prevertebral fascia and the alar fascia is the space which is called the tangent space, and if infection occur here, it will pass deeply into the posterior mediastinum. The second classification is based on the mode of involvement of the space. شنو معناها يعني؟ mode of involvement of the space يعني الطريقة اللي تشكل بها السبيس يعني نتيجة الانفكشن، طريقة إصابة السبيس. عندنا either direct involvement شمول السبيس بشكل مباشر، وهذه يسموها primary spaces الفسح الأولية، يعني أول ما يصير التهاب بيجي عليها الفسح يفتح. And these primary spaces include two group of spaces. The first group is called maxillary spaces. That means the spaces related to the maxilla. So it's called maxillary spaces. And the second group is called mandibular spaces. That's say the spaces in relation to the mandible. The first maxillary spaces include three spaces, which is the canine space, the space in relation with the canine tooth. The second space is called the buccal space. Buccal space in relation to the buccal muscle, oxynator muscle. الخدود، مكان الوجنات، الخدود. والثird space is infratemporal space. Infratemporal space. These three spaces are called primary spaces and related to the maxilla, so they are called maxillary spaces. The other group, of course, we will discuss each space separately later on. The second group of spaces, which is related to the mandible, is called mandibular spaces. This includes four spaces. We have the buccal space, we have the submental space, we have the submandibular space, and the sublingual space. This is the direct involvement. Direct involvement of these areas is called primary spaces. Second, we have the indirect involvement. I will say these spaces involved by infection indirectly. I will say infection reach these spaces from a primary spaces. I say infection in the primary space may spread to another spaces, and these spaces, because it is not the first space to be involved in infection, they are called secondary spaces. I will say there is indirect involvement of these spaces by infection. And these spaces are 7 spaces. The masteric space related to the masteric muscle, the pterygomandibular space between the pterygoid plate and the mandible, the superficial and deep temporal spaces, the parotid space, the lateral pharyngeal space, on both sides of the pharynx, right and left, the retropharyngeal space behind the pharynx, and lastly we have the prevertebral space. All these spaces are called secondary spaces. Secondary spaces, that is to say, after the infection occurs in the primary spaces, infection may spread and reach these areas or these spaces, so they are called secondary spaces, and there are 7 spaces. Here, this picture, very nice picture, show you some of these facial spaces here in the face, of course. Now we will talk about the neck and face and neck. Here, this is a canine space infection. Canine is the site of the canine, and as we said, we have three spaces related to the maxilla. One of them, first of all, is the canine space. So when there is infection here, in close relation with the canine, the infection will spread in this area, which is called the canine space, causing swelling يسبب لنا انتفاخ تورم and edema. Also here the infection and cellulitis التهاب الأنسجة الرخوة involve the upper and lower eyelids. All this swelling, all this thing يجيك المريض هنا خد دوارم من هالمكان هذه وما يقدر يفتح عينه. طبعا هنا المشكلة وين؟ هنا عندنا الcanine space is involved primarily, which is primary space to be involved here from the infection on the canine root, causing this clinical signs of infection of this space. Also طبعا we have another spaces here. We will discuss it later on. This is this green color. This is the buccal space. This is the buccal space related to the buccinator muscle. And of course, here we have the parotid space. This is secondary space, of course, mentioned in the secondary spaces. This is the parotid space. And we have the submasseteric space below the master muscle. This is the master muscle, below the master muscle. And we have the masseteric space now within the between the master muscle and the mandible. And also we have the pterygomandibular space between the pterygoid muscle and the mandible. We will discuss, and this have the superficial and deep temporal spaces. Superficial temporal space, and deep to it we have the deep temporal space. Here we have another illustration here. This is the buccal space, number one, buccal space. From this buccal space, which is a primary space, infection may go to another spaces, which is called the secondary spaces. Here we have the group of spaces, which is called masticatory spaces or temporal spaces. Here is because of muscles of mastication, temporals, and so on. So this is the primary space, this is the secondary space. We'll discuss it later on, inshallah. Of course, this picture also show you another masteric space infection here due to the lower teeth. Here is a problem in the lower teeth, lower gum, causing cellulitis and swelling. التهاب الأنسجة الرخوة مع انتفاخ في الخد نتيجة التهاب في molar teeth, and causing this space to swollen or this space to open, containing the inflammatory fluid and edema. It's called the masteric space infection. Now we discuss each space separately. Each space has boundaries, has contents, and so on, and the source of infection that reaches this space. The first of all, we have the canine space. Boundaries of the canine space include, anteriorly, we have the orbicularis oris muscle. Orbicularis oris muscle, one of muscles of the facial expression that presents in the upper and lower lips encircling the mouth. So anteriorly we have the orbicularis oris muscle. Posteriorly we have the buccinator muscle. Superiorly we have the levator labii superioris ilic nasi. Actually this is the longest name of muscles in the body. Levator levi superioris alignesi. This is name for single muscle. This muscle is causing the elevation, levator يعني elevation استعملنا levi الupper lip, elevation upper lip, superioris طبعا العضلة رافعة الشفة العليا. alignesi طبعا أيضا opening of the nostril of the nose. يعني elevation of the upper lip and opening of the nostrils. So this muscle form the superior boundary of the canine space, levator levi superioris alignesi. In addition to this muscle, also we have the zygomaticus minor, which is also one of the muscles of the facial expression. So these two muscles, levator levi superioris alignesi and zygomaticus minor, both these muscles form the superior boundary of the canine space. Inferiorly, we have the canine, and medially, the medial boundary of the canine space is the anterolateral surface of the maxilla. Anterolateral surface of the maxilla. What are the contents of this space? Of course, in health, not in a disease condition, in health, it contains the angular artery and vein, which are branches of the facial artery and vein, and also the infraorbital nerve, which is the terminal branch of the maxillary nerve V2, the second division of the trigeminal nerve sensation. So the contents of this space is the angular artery and vein and the infraorbital nerve. Involvement of this space, source of infection, how it's reached this space. The infection reached this space, and as I show you in the previous picture, the canine space infection, swelling of the and edema, as I show you. Here, the infection comes from the canine and from the premolar and from the mesiobuccal root of first molar, and this root is actually rarely infection from this mesiobuccal root of first molar rarely can cause or reach this space, but mainly this space is involved by infection through the canine problem or disease and also the premolar. The second space is the buccal space. From its name, it's related to the buccinator muscle. Boundaries, superiorly, we have the zygomatic arch. You know the origin and insertion of the buccinator muscle. If you know the origin and insertion of buccinator muscle, you will know the boundaries of this space. Posteriorly or superiorly, they have the zygomatic arch. Inferiorly, we have the lower border of the mandible. Anteriorly, at the side of the mouth, modulus of the mouth, side of the mouth. Posteriorly, we have the pterygomandibular raphe. What's pterygomandibular raphe? Pterygomandibular raphe, it is a band of fibrous tissue or ligament that pass between or extend between the hamulus of the medial pterygoid plate. You know the hamulus of medial pterygoid plate. The medial pterygoid plate, the inferior part or inferior margin of the medial pterygoid plate, we have a small hook-like structure which is called the hamulus of the medial pterygoid plate. So from this area, from this point, the pterygomandibular raphe or ligament extend to insert or to end in the posterior part of mylohyoid line. You know what? Of the mandible. Mylohyoid line of the mandible, you know, which is the origin of the mylohyoid muscle. So at its posterior end, the pterygomandibular raphe attached. So this pterygomandibular raphe form the posterior boundary of the buccal space. Medially, of course, we have the oxygenator muscle and buccopharyngeal fascia. Oxygenator muscle, you know it. Buccopharyngeal fascia is another fascia that passes between the oxygenator to the pharyngeal wall. To the pharyngeal wall. Fascia. Laterally, we have the skin of the cheek. So this is the buccal space. What are the contents of this space? This space contains the parotid duct. If you remember, when I give you the lecture of parotid gland, we talk about the parotid duct, and I told you to palpate the parotid duct just below the zygomatic arch and anterior to the anterior border or edge of the masseter muscle. So you can palpate it, the parotid duct. So the parotid duct is one of the content of the buccal space. The second content is the anterior facial artery and vein. Anterior facial artery and vein, and also the transverse facial artery and vein. Lastly, we have the buccal fat pad. So these are the contents of the buccal space: parotid duct, anterior facial artery and vein, transverse facial artery and vein, buccal fat pad, and the source of infection, how the infection, from where the infection reached this space. The infection can reach this buccal space either from the maxillary bicuspid or maxillary molars, or from mandibular bicuspids, or from mandibular molars. So these four sites, if an infection occurs in these areas, the infection will spread or will reach this buccal fossa. I want to ask you, what's the source of infection in buccal space? You will tell me that the source of infection, or the infection reached this space either through the maxillary bicuspid or maxillary molars, or mandibular bicuspids or mandibular molars. Spread of infection is to from this buccal space, if there is infection and if the infection is not treated. يعني صار عندنا مشكلة والتهبت المنطقة والتهبت الفوسة وصار عندنا cellulitis والpus collection, and the patient is not treated، ما عالجنا الحالة. هل ممكن أن ينتقل الانفكشن إلى other spaces؟ نعم، ممكن ينتقل الانفكشن إلى other spaces، اللي هي ممكن ينتقل إلى pterygomandibular space اللي راح نشرحها إن شاء الله بعد شوية، أو ينتقل إلى infratemporal space، أو ينتقل إلى submastric space. فإذا ممكن ينتقل على أحد هذه السبيسز اللي سميناها طبعا احنا secondary spaces. if the infection in the buccal space is not treated, or if the patient is delayed presentation ماله delay جانا متأخر, the infection from this space can spread to other spaces اللي هي pterygomandibular space أو infratemporal space أو submastric space تحت منطقة الماستريك muscle. Now, what about the infratemporal space? Infratemporal space, its boundaries are: anteriorly we have the infratemporal surface of the maxilla. Posteriorly we have the mandibular condyle. Superiorly, infratemporal crest of sphenoid bone. Inferiorly, we have lateral pterygoid muscle. Medially, we have the temporal tendon and coronoid process of mandible. I mean, the temporal tendon is tendon of temporalis muscle, which insert into the coronoid process of the mandible. So the medial boundary of infratemporal space is the temporal tendon and coronoid process of mandible. Laterally, we have the lateral pterygoid plate. So these 6 boundaries of the infratemporal space, you should know it very well in order to know where is this space exactly present. What are the contents of this infratemporal space? We have the pterygoid venous plexus, we have the internal maxillary artery and vein, and we have the mandibular nerve. So 3 structures present in the infratemporal space, which are the pterygoid venous plexus, internal maxillary artery and vein, and the mandibular nerve. Source of infection, from where the infection can reach this space, infratemporal space, we have the maxillary molars and through an infected needle. Maxillary molars, if any problem with the maxillary molars, infection, root abscess, or something like this, and the problem is not treated early, the infection can reach the infratemporal fossa. Also, in case of using an infected needle, when you will give a local anesthesia to deal with the problem with one of the molar teeth, and if your needle is infected or unclean or unsterile, putting the needle for to give the local anesthesia may cause infection which reach the infratemporal space. Spread from this space can occur, and the spread either it extends upwards to involve the temporal space. It is an infratemporal. If it may extend upward to involve the temporal space, or it extends inferiorly to involve the pterygomandibular space. Also, if this condition is too late, the infection may extend upwards into the cavernous sinus. The sinus, of course, is with the pterygoid venous plexus. Okay, so all these spaces, the canine, the buccal, and the infratemporal, are related to the maxilla, and they are called maxillary spaces. Now we talk about the mandibular spaces, the 4 mandibular spaces, that say spaces associated with the lower jaw. First of all, we have the submental space. The submental space, it is a potential space present just below the chin region on the medial surface of the mandible. All of you know this submental triangle when we talk about the triangles of the neck, and you know the boundaries. So it is the potential space present just below the chin region on the medial surface of the mandible. What are the boundaries of this submental space? We have superiorly, we have the mylohyoid muscle. Inferiorly, the fascia, platysma, and the skin. Laterally, lower border of the mandible and anterior belly of the gastric muscle. All of you know this anatomy. What are the contents of the submental space? We have the contents, the submental lymph nodes, and also the anterior jugular vein. How this is involved? It is involved either from anterior mandibular teeth. Any problem with anterior mandibular teeth can cause infection in this space, submental space, or it may be secondary involvement due to infection of submental lymph nodes. واحدة من الليف نودز اللي موجودة هنا بالسبمنتال area submental lymph nodes إذا صار بها infection. طبعا شلون يصير بها infection هاي الليف نودز؟ يعني من السكين أو من الجام أو من الفلور اوف ذا ماوث يصير بها infection هذه الليف نودز، وبعدين if the patient is not treated إذا المريض ما تعالج وما أخذ الأنتيبيوتيك بشكل صحيح ممكن إنه يبيها swelling يصير الليف نودز يصير بها infection، وممكن إذا كلش ليت المريض ما أخذ علاج ممكن يصير بها pus collection، كلها تصير بها عبارة عن pocket of pus، عبارة عن جيب من البص and swelling below the chin which is very painful، تكون كلش وتحتاج surgical treatment. So it may the second way is secondary involvement due to infection، التهاب of submental lymph nodes following lymphatic spread بعد الانتشار عن طريق الأوعية اللمفاوية from the lower incisors، ممكن تكون من lower incisors من القواطع السفلى بالمانديبل، أو من lower lip or from skin overlying the chin، skin overlying the chin. هنا عندنا فد infection بالسكين مثلا wound بالسكين، أو عندنا فد بويل حب شباب ملتهب كلش هنا بالذقن منطقة السكين اوف ذا تشين، ممكن ينتقل عن طريق الليمفاتيك انفكشن، الالتهاب ينتقل عن طريق الليمفاوية إلى إلى السبمنتال lymph nodes، أو from the anterior part of the floor of the mouth، أو from the tip of the tongue and sublingual tissues. All these structures when it is infected may cause spread of infection to the lymph nodes in the submental lymph nodes, and if not treated it will cause swelling and even pus collection, and it convert to an abscess, need surgical treatment. Spread, can this infection from this area spread to other infection can spread posteriorly. نعم من السبمنتال ممكن ينتشر الالتهاب من هاي السبيس إلى other space to involve spread posteriorly إلى الوراء to involve the submandibular space حتى يصيب لنا submandibular space or may discharge on the face in submental region، أو ممكن يكون الالتهاب يخرج من السكين. طبعا of course all these things if the patient is not treated، فممكن أيضا يطلع لنا فد pus discharge يطلع من السكين منطقة السبمنتال region. Submandibular space, the second space, submandibular space. This potential space lies between the anterior and posterior bellies of the gastric muscle. The boundaries of this submandibular space include anteromedially the floor formed by mylohyoid muscle, posteromedially the floor formed by hyoglossus muscle. The hyoglossus muscles, you know the position of the hyoglossus muscle between the hyoid bone and the tongue, hyoglossus muscle, shown which is posterior to the mylohyoid. It is to the inner side of the mylohyoid and posterior to the mylohyoid muscle. So anteromedially, the floor is formed by mylohyoid muscle. Posteromedially, the floor is formed by hyoglossus muscle. Superolaterally, medial surface of mandible below the mylohyoid line. Anterosuperiorly, anterior belly of the gastric muscle. Posterior-superiorly, posterior belly of the gastric muscle, stylohyoid and stylopharyngeus muscles. Laterally, of course, we have the platysma muscle and the skin. So these are the boundaries of the submandibular space. What are the contents of submandibular space? The contents include superficial lobe of the submandibular cerebellar gland, If you remember the submandibular gland, three glands, if you remember it, it has two lobes, superficial and deep lobe. The superficial lobe of the submandibular gland is one of the contents of the submandibular space. The second structure is the facial artery. Third, proximal part of Wharton's duct. What's Wharton's duct? Wharton's duct is the duct of the submandibular salivary gland. The duct of submandibular salivary glands is called Wharton's duct. So not all the duct, just the proximal part of the Wharton's duct is one of the contents of the submandibular space. And the other structure is the lingual and hypoglossal nerves. This is very important and you should remember it. When I ask you what are the contents of the submandibular space, you should remember the submandibular triangle when we talk about the triangles of the neck, anterior, posterior, and subdivisions of these triangles. All these things we talk about it in the previous lectures. So I will repeat the contents, which is very important. The content of submandibular space is the superficial lobe of the submandibular salivary gland, the facial artery, the proximal part of Wharton's duct, the lingual and hypoglossal nerves. Involvement, how this space is involved by infection, how the infection reached this space, mandibular molars. This space can be infected by or from the mandibular molars. Why? Because its apices, the apices of these mandibular molars present below the mylohyoid muscle insertion on the mylohyoid line. So how the infection reached this space, this submandibular space, infection reached through the mandibular molars. How? Because its apices present below the mylohyoid muscle insertion on the mylohyoid line. Can infection spread from this space to other space? Yes. The spread can be to the submental, submandibular space on the contralateral side. So the first spread can be to the submental, submandibular and submandibular space on the contralateral side في الاتجاه الآخر. يعني هي كانت مثلا اتجاه باليمين submandibular space, the right submandibular space is infected and containing this swelling and infection in cellulitis and inflammatory fluid. This, if not treated probably early, this infection can spread to the left submental and submandibular space, contralateral side. Also can spread to the sublingual space, from the submandibular to the sublingual space. Or it can spread to the parapharyngeal space، يعني الفسحة اللي حول الفارنكس. أيضا ممكن تصل اللارنكس. طبعا هنا مشكلة لو وصلت إلى الحد هذا، معنى هذا الشغلة كلش تعبانة والالتهاب كلش متقدم والحالة تصبح بها نوع من الخطورة حقيقة. فإذا السبريت ممكن يكون للسبمنتال and submandibular space on the contralateral side، ممكن يكون to the sublingual space اللي هنشرحها إن شاء الله بعدين، وكذلك ممكن يكون أيضا للparapharyngeal space. Now this space, the another space is the sublingual space. Sublingual space, it is a V-shaped trough. شنو trough؟ trough يعني مثل حوض أو جرن، مثل حوض. is a V-shaped trough lying lateral to the muscles of the tongue. What are the muscles of the tongue? Hyoglossus, genioglossus. Okay, these muscles, lateral to these muscles, we have this V-shaped trough, which is called the sublingual space. What are the boundaries? Superiorly, the superior boundary of the sublingual fossa space, is the mucosa of the floor of the mouth. Mucosa of the floor of the mouth. Inferiorly, we have the mylohyoid muscle. mylohyoid muscle. Medially, we have the muscles of the tongue, the genioglossus, hyoglossus, and geniohyoid muscles. These are called the extrinsic muscles of the tongue. These three muscles are the extrinsic. Three or four, actually. Here, we have this three form the medial boundary of the sublingual space: genioglossus, hyoglossus, and geniohyoid muscles. Laterally, we have the medial side of the mandible. You remember the lingual fossa on the medial side of the body of the mandible? Yes, this forms the lateral border of the sublingual space. Anteriorly, we have the lingual surface of the mandible. What do we mean by lingual surface? It is the most anterior part of the medial surface of the mandible. Posteriorly, we have the submandibular space and hyoid bone. Submandibular space and hyoid bone. Well, this some small or simple picture show you this space, sublingual space تحت اللسان, sublingual space, and submylohyoid space, which is submandibular, it's also called submylohyoid space. Here, both of these spaces here also can be called both of them submandibular space, because both of them below mandible, but don't depend on this. We see that this is the sublingual, and I gave you the boundaries of it, and here is the submandibular space. Also, I gave you the boundaries of it. So what are the contents of the sublingual space? The contents are the muscles of the tongue, اللي هي geniohyoid, genioglossus, and hyoglossus muscle, the deep part of submandibular cervical gland and duct. Remember, the submandibular, we have the superficial part of the submandibular gland, but here we have the deep part of submandibular cervical gland and duct, all the duct تقريبا, and sublingual cervical gland and lingual and hypoglossal nerves. So these are the contents of the sublingual space. Spread of infection, from where the infection reaches the space, the infection may cross the midline. نعم, ممكن ينتقل للother side. If it is in the right, it may go to the left, may cross the left, the midline. Spread may be from posterior inferior part, from the posterior inferior part of the space to submandibular gland and space. Also spread may be via lymphatics, عن طريق الأوعية الليمفاوية, to submental or submandibular lymph nodes. أيضا ممكن يصل إلى submental or submandibular lymph nodes via lymphatics, عن طريق الأوعية الليمفاوية. ممكن ينتقل الالتهاب from the sublingual space to the lymph nodes, the submental and submandibular lymph nodes. I will stop here to continue, inshallah, the lecture of facial spaces in the next lecture. Thank you very much.